Right, so I have a problem both here and in my index and middle finger. This is tingling and it's numb, and my wrist also, there's some pain in the corner of my wrist. It seems to be travelling up my arm through to my neck. There seems to be a lot of tightness in my neck muscles. So at this point the only thing I can think is there's some kind of pinched nerve up here which is affecting the whole right side of my body.
So we feel there's a lot of muscle tightness on the left side. And we compare it to your right side. See, it's not as tight. There's a little swelling over here. But it's nothing like your left side. A lot of significant swelling over here and a lot of muscle tightness here as well.
Yeah.
And we also feel on your right side, there's a lot of muscle tightness over here.
Yeah.
Okay? And it's kind of loose over here. Okay? It's not as bad. Feel this right over here? That's a lot of swelling right in this spot right over here. Okay, and you don't have anything on this side, on the left side over here. Okay, you feel that nice little knot over there?
Yeah.
Right? It feels like a little P in there.
Yeah, what is that?
Okay, that's the swelling we're talking about. Okay, now we're going to check every single structure. We're going to see how your structure is moving. Okay, we're going to challenge it going back and forward. Normal is supposed to move back and forward without a problem. Abnormal is going to be stuck in place. It may actually be tender. Feel that one right there?
Yeah.
That's not moving too well.
No.
Tender?
Yeah.
Yeah. Does that also duplicate your right hand problem too?
Yeah.
Okay. Now I'm going to see how it goes. So you could tilt your head to the left. See how much issues you have rotating and tilting towards the right.
Yeah.
Okay, so that indicates that a lot of structural issues going on right there in the sixth cervical. Okay. Next thing we're going to do is we're going to take a look, see how you're rotating. Okay, so once again, you could turn your head easily to the left. Got some issue rotating to the right. Can't turn your head over to the right. Feel that difference right there?
Yeah, a little bit.
Yeah, right.
Not too dramatic, but definitely there.
It's most certainly there. So
it's like 185 that way.
exactly. So we already identified this is the one that's a problem. We saw with the instrumentation, yes, there's a nerve that's being irritated at this level. There is swelling right here, muscle spasms over here. X-rays indicated that this structure over here is backwards, okay, and rotated in a very particular direction. This is the one we need to correct. In this X-ray structural analysis, what we see is this is what normal is supposed to look like this space right over here. However, we see on the 4th, 5th, and 6th, there's a lot of breakdown and a lot of degeneration. In essence, we're seeing a lot of this fell over here, and the 6th cervical disc, we're seeing this fell over here. So, taking a closer look, what caused all these fellas is actually right here. This bone moved backwards and also tilted backwards as such. So this is the one we need to correct. There we go. What difference do you notice right now in your fingertips?
It does feel like it's subsiding. It hasn't gone, but it feels like the tingling has gone.
Mm-hmm.
Tingling has gone. Still a bit numb, but tingling has gone.
How much numbness would you say is left over?
Well, because I've sliced my finger open, it's hard to tell. It's definitely better though.
All right.
Yeah.
So let's take a look at your wrist. Okay, face towards me. Okay, so feel this one over here? There's too much movement.
Yeah.
Okay, when compared to your left. Okay, it doesn't move as much. Do you feel that difference there?
Yeah.
Okay. Whereas this one?
Very loose.
Very loose. So, take a look at your elbow. that difference here? This over here is solid, but when I deviate it towards this way, do you feel that difference?
Yeah.
There's too much movement towards that direction. So now we're gonna check what's going on with the radius. Okay, this over here. I'm gonna fix it. There it is. Did that nice little fellow pop?
Yeah, what was that?
So we just fixed this bone right over here.
Yeah, that's where the pain is there.
Hold on a second. We're gonna fix your pisiform. This small little bone right over here.
Yeah.
Okay. Go ahead and move your hand around, see how you like it. And how's these two fingers right over here?
Yeah, getting better.
Okay, so fill me in. How's the wrist and the fingers?
So it's been about a week since I last saw you. I think dead on a week.
About.
And my wrist is 90 to 95% better, maybe more. And the tingling in the index finger and middle finger are now at least 30 to 40% better. The neck is feeling better. And for the hips, what you did down there, it's dramatically better. I can sit with my legs kind of almost parallel now, which is a new feeling. And I do feel overall that I'm more aligned, so all good. I'm definitely going to the bathroom with much more regularity than I used to.
So Howard, how's the fingers now?
They're fantastic. From non-stop pain and numbness and getting worse during the day to pretty much back to how it was before.
So, any residuals or absolutely none left?
I mean, it's 1% of what it was.
1%?
Yeah.